Thompson's fatal shooting pushed Americans' dissatisfaction with their health insurance into the spotlight. Many have made their frustrations abundantly clear on social media. Journalists have also chronicled insurers' efforts to twist the system to their benefit. Stat, a news site that focuses on health care, has published a series of investigative stories on UnitedHealth, including articles on how the nation's largest health insurer uses a computer algorithm to cut off rehabilitation care for Medicare enrollees, limiting clinical case managers' discretion. Whether the public outcry prompts UnitedHealthcare and other insurers to adjust their practices, particularly the much-maligned denials of treatment and claims, or pushes lawmakers to force the industry to make changes remains to be seen. It depends, in part, on whether patients continue making their voices heard, experts say. Angry consumers have had success in overhauling the health insurance industry in the past. They railed against the restrictions of health maintenance organizations, or HMOs, in the 1990s, as captured in the 1997 movie As Good as It Gets. That helped spur insurers to offer more preferred provider organizations, or PPOs, which have fewer constraints but are more costly. Any shifts in the nation's complex healthcare system, however, will not come easily, nor quickly, experts say. There are many players involved, each of which has its own patient care concerns, financial interests, and lobbying dollars to influence lawmakers. While many patients and their advocates argue that insurers deny care to pad their profits, the industry maintains that it is protecting consumers from high prices and unnecessary care. Soon after Thompson's murder, Witty vowed in an internal message to employees to continue the insurer's mission of helping the system improve. Our role is a critical role, and we make sure that care is safe, appropriate, and it's delivered when people need it, said Witty in a video message obtained by CNN. And we guard against the pressures that exist for unsafe care or for unnecessary care to be delivered in a way which makes the whole system too complex and ultimately unsustainable. So we're going to continue to make that case. What we know to be true is that the health system needs a company like UnitedHealth Group, he continued. Asked Thursday whether it will make any changes in response to consumers' public complaints, UnitedHealthcare referred CNN to Witty's video. Other major insurers either did not return requests for comment or declined to comment, but a leading industry association said that hospitals, providers, and employers all have a direct impact on the cost and accessibility of medical services. In the fragmented and heavily regulated healthcare system, health plans, providers, and drug makers share a responsibility to make high-quality care as affordable as possible and easier to navigate for the people we collectively serve. HIP, the trade group, said in a statement. Health plans are working to protect patients from the full impact of rising costs while connecting them to care that is safe, evidence-based, and coordinated. But the recent events may prompt insurers to investigate their practices and make some changes, Julie Utterback, senior equity analyst at Morningstar, wrote in an email to CNN. This is especially likely if they see risks to their businesses, such as if employers threaten to leave because coverage decisions are too onerous for their workers. On the flip side, the main reason to not change their practices is to maintain their profitability while also keeping costs reasonable in a broad sense for their clients and end users. Utterback wrote. UnitedHealth Group CEO, America's health system is poorly designed. In his first public response to the consumer outcry following the fatal shooting of one of his top executives, UnitedHealth Group CEO Andrew Witty said Friday that the U.S. health system is not perfect, and that coverage decisions are not well understood. We know the health system does not work as well as it should, and we understand people's frustrations with it. Witty wrote in a guest essay in the New York Times. No one would design a system like the one we have. And no one did. It's a patchwork built over decades. Witty also defended UnitedHealthcare, the company's health insurance arm, though he acknowledged that it shares some of the responsibility for the lack of understanding about decisions on care. Together with employers, governments, and others who pay for care, we need to improve how we explain what insurance covers and how decisions are made, Witty wrote. Behind each decision lies a comprehensive and continually updated body of clinical evidence focused on achieving the best health outcomes and ensuring patient safety. Witty also praised UnitedHealthcare CEO Brian Thompson, who was killed in Midtown Manhattan last week, writing that Thompson fought for preventive health and quality health outcomes rather than simply adding ever more tests and procedures. In a statement on Friday, UnitedHealthcare said, "Highly inaccurate and grossly misleading information has been circulated about our company's treatment of insurance claims, and that it approves and pays about 90% of medical claims upon submission," noting that around 0.5% are due to medical or clinical reasons.